Well, hello and welcome to Ask the Doctor. My name is Jerry McGee and I'll be your host for today's show. We're here in Pittsburgh, Pennsylvania at Wellness Associates with Dr. Eugene Goldberg. Dr. Goldberg, thank you very much for your time today. On today's episode, we want to talk a little bit about preventative medicine. We've had a lot of people write in with questions that they're not really necessarily having any specific problems. They are maybe a little sluggish, maybe, little aches and pains, and, doctors keep telling them they're just getting older. Okay, they think there's more to it. They hear us talk about, preventative evaluations and kind of coming in for those tune-ups. So, and I guess their real question is basically what goes on. What can a chiropractor actually do for me from a preventative standpoint? So, if I was walking in off the street and I just said, "Hey, listen, I'd like to come in and talk with you, kind of learn more about my health," what would you do for me?
People think we're back doctors, Jerry. Really, we're nervous system doctors. We look at your brain and your spinal cord, which is your central nervous system, which controls your body, okay? So we would want to look at your structure, because 90% of the time, Jerry, you could have a problem, and 90% of the time you wouldn't know. Why? Because 90% of your nervous system is silent. It's sort of like your teeth. You can have a cavity, and when you get checked every 6 months, you don't know that you have a cavity until the dentist finds it. So it's a preventative thing. If you have a cavity in your back, let's correct it with a specific chiropractic adjustment, a specific chiropractic alignment, and nip it in the bud. Because it's like a cavity, it can get worse. In fact, we know it gets worse. It's the law of entropy. You can't stay the same. So just like a cavity becomes a root canal, which becomes a bridge, which becomes the dentures, it's the same thing with your spine. Now, the unfortunate thing, you can't get dentures for your spine. So what I do is I take care of myself. I check people for subluxations, misaligned vertebrae, and it's a very proactive thing. Why? Because an ounce of prevention is a pound of cure. Of course, 9 times out of 10, what we want to do is take a picture. We call this the fingerprint exam. And what this does, Jerry, it looks at your spine like it's a snowflake. And what that means, it's never before been seen, never to be seen again. It's a very unique thing. So if you have a problem, if you have an issue, if you're having aches and pains, hey, we live in a cause and effect universe. There's a reason why you're having aches and pains. I don't have any aches and pains. If I did, I would get an adjustment, which I do anyhow, as a preliminary thing, just as a preventative thing. Okay?
Now, so when you take a person that says, all right, I want to start taking a more active role in my health, right? And so they decide to come down and come to an evaluation. What goes on then? I mean, so if I was coming back for some period, I guess basically for a routine maintenance program, what would that really consist of?
I would definitely want to check your spine, check you for misalignments, see exactly what's happened to the spinal dynamics, check you for misalignments, and then what we would do, Jerry, is we correct it. Now, in addition to that, I answer people's questions. They ask me about diet, their lifestyle. We do nutrition here. I don't know if you know this, Jerry, but every day you need 90 nutrients every day. See, to me, the ultimate prevention is doing the nutrition as a prevention so you don't get the disease. Okay? Because my understanding, a lot of diseases are due to lack of nutrients. So if you give the body nutrients, you keep the spine aligned so you're feeling fine. Okay? You have a good lifestyle, you're not smoking, drinking, taking drugs. Okay? And then your diet, everything that you put in your body, you're responsible for that.
And I think it's important for our viewers to understand that from a preventative standpoint, maybe, so I came in, I got my initial kind of evaluation, kind of got some corrections, maybe every once,
everybody's different.
Yeah, I mean, things will change. Maybe once a month I'm coming in, maybe once every 2 months,
yeah.
or
everybody's different,
right? But I think it's, we always make this comparison to our automobiles, which we go in for inspections and brake checks and check your transmission and all this kind of stuff. Yeah. But we really don't do that on our own body, and then we wonder why we break down.
Think of your body being worth $44 million, why it is. So if you had a car worth $44 million, do you think you would give it front alignment? Would you give it a tune-up? Would you change the oil? Basically, that's what we're doing, okay? We're checking you for regular maintenance. Some people it's once a month, some people it's twice a month. Everybody's different. If you're a blue-collar worker, it seems to me, you may even want to get it once a week, okay? Why? Because your body's your livelihood. So what that means, Jerry, is no body, no money, no work, no food, no eat, no live. You're making life and death decisions, okay? So your body is actually worth $44 million. Now that you know that, are you going to take care of it better?
Yeah, I think, with all the changes we've seen in healthcare, we both agree very highly that there's not enough emphasis put on the preventative end of things.
Definitely.
We could solve this healthcare problem if we got more involved with preventative medicine versus treating the problem on the back end.
I agree with that 100% because an ounce of prevention is worth a pound of cure.
Yeah. And really, everybody watching this show, we want you to understand that it is up to each of us as individuals. right? There's nobody else to blame for our own health but us.
I would agree.
Right? We're the ones that, dictate what we eat, how we live, everything that goes on. So if you're concerned about your health, looking to make some changes, now is the time to start. Pick up the phone, call down here to Wellness Associates, come in and see Dr. Goldberg. He offers a great free evaluation where you can kind of see what goes on. He can kind of tell you where you're at, what's your starting point, and just kind of make that first step. And we all know in any program, the first step is the hardest.
Yes.
Making that step, coming down, meeting everybody, getting involved, understanding your health, that's where we all need to be. So if you're interested in starting a preventative maintenance program, this is where it needs to start. Call Wellness Associates today. Talk to the girls at the front desk. They'll explain everything to you. They accept all the insurance policies that are out there. So they'll explain that all up front for you. You'll know everything that's going on. Come down, free evaluation. How can you go wrong? It's a win-win for everybody, and you'll get a great education on the impact of chiropractic care and the difference that it can make in your life. So thank you very much for watching our show today. We hope you kind of pick up that phone and really start taking an active role in your health. So have an awesome day, and we look forward to seeing you on one of our future episodes.